I'm with Dr. Robert Bean of IMC, and first of all, great to talk to you.
You
And
too.
I'm excited to talk to you about me. Forget all the people watching, but my knees hurt, and I have heard so many really cool things about stem cells. Talk to me about why that's your passion and why you've moved to Utah just to get a chance to practice and help people here.
Sure. So stem cell therapy has come a long ways. We first learned about stem cells and how they're being used to help repair and regenerate our bodies since the 60s. However, it was a very niche area within medicine that wasn't taking off, because in the early days they were using embryonic stem cells, which is where you actually combine a sperm and an egg and create an embryo and then destroy it in order to use the cells.
So it was very controversial.
Absolutely, sure, and for good reason. We don't do that. It's not allowed in the States anymore. It's illegal. It is in some research facilities, but it is not utilized within the States at all.
And we don't need to, because we create our own stem cells.
That's correct. So as of more recently, just in this last decade, stem cell therapy has become quite a niche within medicine, where we have learned how to acquire stem cells from our own body and learned how to concentrate them and then use them within the body to help regenerate and repair damaged tissues, and actually start the process of helping people to come over I don't want to say that. You can cut and splice everywhere, right? So I can constantly screw up. Good.
So why don't I ask the question again?
Yeah.
Or let me rephrase that. So by using the body's stem cells, it's really the most natural and wholesome way to help you out, rather than doing invasive surgery or drugs or that sort of thing.
Absolutely. This really should be a first type of intervention for most, when it comes to especially things like autoimmune conditions or degenerative arthritic joints of the body. Just has such profound effect in those areas.
And it's funny, so I've got horrible knees, bone on bone, both knees, and I finally had the shoulder, so I'm breaking down. The warranty is up on me as an aging jock. And I got so addicted to those shots that you get every 90 days to keep me going.
Sure.
And it's not natural what they're putting in you.
No, it's typically a cortisone type base. And it is very effective as far as anti-inflammatory, but it's actually, over time, it causes more damage.
That's what the doctor said. So
Yeah.
you'd get a shot, and about, let's say, for the first 45 days after you get a shot, you feel like a superhuman.
That's right.
The next 45, not so much.
That's right.
Those those cortisone injections, you can only get every 90 days.
Right.
So for 45 days, you feel great.
Well, that has been revised. Actually, you're not supposed to have more than 3 a year.
Ruh-roh.
Okay, so that's typically the maximum you're supposed to have per year. However, I wouldn't do that year after year, because like we say, it actually does more damage in the long run.
And that's the beauty of stem cells, and why I'm so excited to talk to you today, because here's a way to naturally allow you to get back that range of motion that you had when you were younger.
That's right.
And that's what we're looking for.
Absolutely. Absolutely.
So no one wakes up at 18 years old and says, I wish I had bad knees.
Yeah, right.
How did you find stem cells? And tell me about your process to become so excited.
Well, I've been in clinical practice for over 20 years now, out in Seattle.
You started when you were 12?
Yes.
Okay.
I'm just kidding. You threw me off there. I wasn't 12.
Okay, so you've been in practice. Sorry about that.
minutes.
I always have to be a smart ass. That's what my
That's
MO.
good.
So when did you start
Where are you
practicing?
going? Now you got me blushing. I'm going to be all red. Yeah, I know.
You're very youthful.
Sorry
For
about that.
being 84, I've never seen a guy look so good. So
All right, so rephrase that.
how did you become so excited about stem cells?
Okay. So after having been in practice for over 20 years, I did learn a few things, okay, about how to help the body heal and repair. That's what I've always looked into. Is everything I've ever done has been centered around regenerative type interventions, something that we can do to help the body naturally heal and repair itself, as opposed to looking for the miracle cure from the outside, something that you can take a pill, a potion, a lotion, something that's going to stimulate healing and repair within the body. It's an inside-out job.
And that's funny you should say that, because so many people, if you turn on late night TV, what did you call a pill, a potion?
Yeah, that's all it's full of, right? Pills
It-
and potions and lotions.
Exactly. And none of them work.
Right.
Well,
Or temporarily, maybe,
yeah.
perhaps.
But your idea of using the body itself to regenerate tissue is
Yeah, it's there, so why not use it? You know, what we've discovered within the science community, what they've discovered is within the body, we have these stem cells that are available. Our body has them throughout the tissues, all throughout the body, everywhere. And it's what replaces dead, dying tissues. It's also what the stem cells are what are used by the body to help stimulate repair and
So
regeneration.
doctor, if we didn't have stem cells, we would all die at the age of 3.
Yes, within weeks. If you stop producing them, yes, you'd expire quite quickly.
So this is totally natural.
Absolutely.
How were they discovered?
Well, it goes back a few years, but actually in Southeast Asia, actually was some of the first countries that discovered that there are unique concentrations of stem cells within the body, and particularly the fat material. Now, most people have heard of a bone marrow transplant, correct? You've heard
Certainly.
that before. Okay, that's been done since the 60s as well. Well, really what that is a stem cell transplant, where they would use a donor's bone marrow. You tap into the bone. It's not the most comfortable procedure, but they have to tap into the bone marrow of a large bone in the body, like the hip or the femur. And then that bone marrow would be transplanted to a donor who has either had cancer or something to that effect. And so that's been done for a long time. The trouble with it is, as we age, the bone marrow becomes uniquely depleted in stem cells as we get older. So when we're your age and my age, there's very little left in the bone marrow. But what they discovered around 2001 was that the fat material is uniquely gifted with large concentration of stem cells. Why? Hard to say. I don't know that anybody really has a great answer for that. However, it's there, and it's readily accessible. We
Good
all
news
have
Good news
Yeah.
for me, Doc. I think we might find a couple
Yeah,
cells.
I think we can all readily donate and be okay with that. And so fortunately, there's a lot of stem cells in there. And so we've learned, we have the lab and we have the equipment necessary to process that fat, to extract the stem cells, concentrate them in great numbers. Even just, I would say, maybe 2.5 years ago, we'd be elated if we could get 1 to 2 million stem cells from a procedure. Today we're getting between 30 to 50 million stem cells in concentration.
Just in a
And
couple
that's-
years.
That's amazing, yes. Yeah.
So is there going to be a systematic growth in the ability to understand this? So in other words, as years go on, stem cells are going to become more and more valuable.
Absolutely, especially even more recent now, what we're learning as labs across the country are playing with these stem cells and seeing what can they do, how do they do what they do. We've learned even more now, and so we're understanding why it is that the stem cells are so uniquely situated to repair the body. We understand what they're doing.
It's got to be pretty darn exciting to be you.
Oh, you bet.
Because every Monday you look at a new medical journal and you're finding out more areas that stem cells
Yeah.
can help your patients.
It's fascinating. Every single day there's a new article coming out about what they're doing and different labs across the country and what they've discovered.
So this is,
So it's great.
to equate it to something, this is an arms race for stem cells, where smart people at labs and at universities around the country are doing their best every day to try to bring this forward.
Yes, absolutely. We've got universities across the country who have now set up stem cell departments just for this purpose.
And it is funny you should mention that. In reading to learn more about stem cells prior to this interview, the University of California at San Francisco Medical School is considered by many the top medical school in the country.
Yes.
And the name of their stem cell lab is the Roddenberry Stem Cell Lab,
Right.
after Gene Roddenberry from Star Trek.
Oh gosh, yes, that's great.
And literally, this gentleman decided that this is something he wanted to use in his. And what is more Star Trekian,
Yes.
if that's a word, than the ability to use our own cells to repair tissue and to repair and make you feel better?
That's right.
So it's kind of a full circle. So when you got into this, do you remember your first super success and how that made you feel, where you're really able to help a patient?
Oh, absolutely. So I While I was still in practice, I was working side by side with a new stem cells company that was just coming up, the Northwest Pain Relief Centers out in Seattle. And they were one of the first that got busy doing this type of work for people. And so to see people who've got knees that are almost bone on bone, and it's funny because we hear that all the time. People tell me, oh, doc says I'm bone on bone, I need a knee replacement. Well, we just kind of chuckle at that, honestly, because that's rarely the case. There are occasions where, yes, someone's actually in a grade 4 degenerative osteoarthritic knee, but more often than not, it's not that far along. And so it's still salvageable. It's still a knee that you can repair, that you can bring back. And so to actually see visibly on an x-ray or an MRI that the tissues are healing and repairing, and to seeing the joint space expand like back to normal is quite dramatic. You can't miss that, it's just amazing.
That has got, the first time you saw that had to be a great feeling.
Absolutely, yeah.
Because you knew that now your life's work is
Right.
possible. And I went through a shoulder replacement in April, and we were talking before we started taping.
Right.
Everything went right, but it's still $50,000 to $80,000. It's still 30 or 40 trips to go to physical therapy.
Right,
It's a couple nights in the hospital,
correct.
and a lot of pain.
Yes.
And so with stem cells, I didn't need to go through that.
Probably didn't. I don't know that for a fact. Obviously, I haven't seen your x-rays or MRI. But yes, more and more often that is true. That really the stem cells should be the first line of defense in these sorts of things.
So it'd be a sea change in medicine if, in fact, and people my age are going through it. If you've been an athlete most of your life, you've been around, you're going to need a replacement, just the way it is, because we do a lot more with our knees, ankles, shoulders,
right.
that sort of thing. But also we're finding people with a lot of other maladies are getting benefit from stem cells. Can you talk about some of the other things?
Yeah. So one of the unique things about that our company that I'm really quite proud of is that we are part of an IRB, which is an institutional review board. So those are protocols filed with the FDA so that they can monitor exactly what we're doing, how we do our procedures, and what kind of outcomes we're getting. And so for that reason, we're allowed to track these over time, so we can work with a patient, not just have them come in for a procedure and then let them go, but to actually follow up with them every 3 months over the course of a year, and then on an annual basis over the course of 5 years. So we're really doing some good study work. So, like you're talking about different conditions. So
Sure.
we have a whole list of different types of conditions that we're studying with stem cell therapy. So, for instance, rheumatoid arthritis, right? That's a horrible.
That's a killer.
Absolutely. It systemically destroys the body as well as the joints. Most notably, people complain about joint pain with rheumatoid arthritis. Well, rheumatoid arthritis is an autoimmune condition. Okay, it's a condition where your immune system is mistakenly attacking joints of the body as foreign. Okay, well that's not normal. That's not something the body's designed to do. Now, what causes that is still up to, there's lots of opinions there, but probably some of that genetic, some of that environmental, right? Well, when we take these stem cells, okay, again, when we remove the stem cells from you, from the fat tissue, and concentrate them, and then send them into the body as an IV, okay, these stem cells that go into the body.
And we're talking millions of cells.
Yeah, tens of millions, right? Just through an IV, just if you can imagine yourself at a hospital, you got the little bag and it's dripping into the arm, right? So that's how we send it through as an IV. Now what's unique or special is that as these stem cells go back into the body, they start to excrete something called, this goes back a number of years, but what I learned in biology is that your cells produce little garbage trucks, and they're little, these are nanometer molecules, they're tiny little things that the cells excrete out into the periphery, into the extracellular space. And then you have these chuck wagons that would bring food back to the cell. So it looked like the cell was excreting waste and bringing in nutrients.
And that's just part of the process.
And that's what we learned when we were young in school. What we know today is nothing could be further from the truth. This is probably one of the latest miracles of medicine, that we've learned that stem cells produce what are called exosomes. And these are these tiny little, I'll call them bubbles, for a lack of a better word, inside the cell. It goes out to the cell wall and then excreted out into the periphery and circulates through the body. Those are the exosomes, and what we've learned is those are signaling molecules, okay? And they have a unique ability to change the body and how it's reacting. It stimulates growth and repair throughout the body. It downregulates the immune system that is acting inappropriately, such as rheumatoid arthritis. Rheumatoid arthritis, you can get to either go away or at least go into significant remission through just IVing your own stem cells.
My God. I mean, there have been some very famous people who died of that malady.
Absolutely, sure.
And it's a pretty painful process. I mean,
Right.
really,
Right.
pretty horrible.
Now, typically, to be clear, a one-time shot usually doesn't do it. This is typically something that we have to do over the course of a year, maybe 2 years, of doing these infusions with your own stem cells every 3 months. That's typically how we do it right now. And that
So it's a
seems to be-
protocol.
It's incredibly effective. Not just rheumatoid arthritis, but you think about all the autoimmune conditions. Lupus, erythematosus, Sjogren's,
Crohn's disease?
Crohn's disease is going to have that. Irritable bowel is kind of in that category as well. These are all things, multiple sclerosis, of course, is another big one. So these are all conditions that are showing positive effect with infusing your own stem cells. You know, it's just such a vast contrast to what's happening today, currently, if you just go through the normal medical routine.
So, Doc, the challenge here is there's some people out there who are saying that stem cells will cure everything, and there's some
Right.
charlatans out there.
Sure.
How do people who are watching avoid these people?
Okay. Excuse me. I'm glad you brought that up because
Oh,
that
let me
is-
start it again. So,
Yeah, go ahead.
So, Doc, the challenge in researching this is that there are a lot of people out there making false promises. There's some charlatans out there. How do our viewers avoid running into those people?
That's a great question because there is a lot of fanfare out there right now with stem cell because there are so many of these clinics popping up all across the country. Physicians wanting to jump into this pool of stem cell therapy because it's incredibly lucrative, or it can be if you've got a real busy office seeing a lot of folks, okay? There is no insurance for it. Unfortunately, at this time, there's no insurance for stem cell therapy. So this brings up an important point, and that is, where do you get your stem cells from? Okay, so we get our stem cells from your own body. That's how it's done. That is stem cell therapy. That's appropriate way of using stem cell therapy, is pulling the stem cells from your own body and then using them to help your own body. What we're seeing pop up now is that we've got groups that are doing what are called afterbirth products, umbilical cord stem cells. What else? We've got amniotic tissue, placental tissues. Now those tissues, umbilical cord, the placenta, the amniotic sac, yes, these do have stem cells in it. But now we're talking about a donor, okay? And that is not being tested. Meaning if you go to an office where they said, we're gonna use these really young afterbirth, baby stem cells, which are extremely active and have a lot of youth and energy. Well, that's true. However, there's a problem with the logistics, meaning first of all, we're not being tested if you're a match for these cells, which they say that they're immune privileged. Well, to some degree, yes, but not entirely.
I mean, that makes more sense to use my own stem cells
Sure it does.
because they're a perfect match.
Right.
I'm not going to have a rejection of my own
Right.
cells.
Okay, but to do that procedure, you've got to have a lot of things in place. You've got to have the lab necessary to do it. You've got to have the physicians who are skilled at being able to do that type of a procedure. The liposuction that's necessary, the IV, all the equipment that you need in order to perform that is quite an investment. It's a lot easier route to simply go buy amniotic stem cells on the market. There are some biotech companies that are happy to sell it to you for cheap. And you can set up a clinic on a roadside office and say you're promoting stem cell therapy, when in fact, there are no cells left in those products, unfortunately.
So they are really, they're charlatans. I mean, they're promising you something they can't
They
deliver.
are promising something they can't deliver. It's just not possible. From bedside in the maternity ward to an ice pack to a lab to processing making sure there's no bacteria, no fungus, no parasites, no viruses, all these things, to that processing, to cryo-freezing it, to thawing it back out, and then drawing it up in a needle and going into somebody's knee. By the time you get to that point, there are no live cells left in that concoction. They're dead.
And good people are paying money to these companies for something that's not going to work.
Unfortunately. And that's a growing number of people who are going to be dissatisfied and say, well, I tried stem cell therapy, it didn't work for me. That's unfortunate because they really didn't get an opportunity to do stem cell therapy.
Wow. How do people determine whether is it just something you call a clinic and say, are you using my stem cells? Or
Yeah, that's a great leading question is where do you get your stem cells?
So if a clinic gets stem cells from yourself, then they obviously have made a commitment in time, energy, research, and equipment to make sure they have great outcomes.
That's correct. It's got to be bedside. You've got to be able to have the cells, what we call harvesting your stem cells, and be able to re-inject them within an hour's time.
So time is crucial.
Absolutely.
So taking care of the biological material, doing it in a quick fashion, processing it, getting it back into you within an hour shows that practice has a commitment to professionalism.
That's right, because now you know you're getting live cells. And one of the beauties of today's medicine is we can actually have cell counters, and we can count the cells, and we can see that they're living cells. And
so you know right off, you can look under a microscope after you shockingly enough could find a little fat on my body,
right,
and pull out the stem cell. You would be looking at those stem cells and know immediately.
Right.
That's got to give you a tremendous, or as a patient, I should say, a tremendous amount of comfort.
Well, absolutely. It's nice to be able to go to the patient and say, wow, this really turned out fantastic. We got a large number of stem cells, and we can tell you how many you got, which is nice.
And the other thing you said a little earlier is that the amount of stem cells that you're processing is grown exponentially in the last couple of years.
That's correct. We're getting better and better at processing the fat.
Wow. What are some of we talked earlier about success stories.
Yeah.
So right now, it would seem to me that a lot of people, obviously arthritis and bad joints, but the autoimmune,
right,
that could really change medicine to a tremendous degree.
Very much so. There's a lot of people out there who could really benefit from, again, being able to concentrate their stem cells and then reintroduce them through an IV or as an injection if it's going to be, again, for a joint or some other types of aging maladies, you might say.
And that's, from just a population standpoint, there are a lot of us in our 50s plus
Sure.
who have things going wrong. When you do a procedure, how quick, for instance, let's say I came in for my knee, and mine is truly bone on bone. I've seen the x-rays.
Okay.
Am I beyond help? Do I have to do a knee replacement, or is there something even bone on bone?
No, if it's truly bone on bone, and you can see it on an x-ray, it's obvious, usually we'll recommend they have a knee replacement. Because to be honest, it's unlikely it's going to come back to a degree that you would appreciate it, that you would say, hey, it's doing fantastic, I'm good to go, I'm back skiing. That's just not likely to be the reality. Grade 3s and less than that are typically a good outcome. More than that, that would be considered a grade 4 type osteoarthritic
And I have
knee.
the other knee has still got some cartilage left.
Right, which
So
would
that
be a
would-
good time to do the other one. If the other one's shot and there's no, we're just not going to save it, it's really good to look at the other knee because more often than not, the other knee is just several years behind it.
And my formerly good shoulder.
Quite possibly.
Yeah, I'm half bionic, I think, by the time everything is done.
Right.
So that's great. So helping people with arthritis and joints, but circling back to the autoimmune, what are some of the other maladies that stem cells, maybe not today, but 2 or 3 years from now, that you're going to be able to help people with?
I see it as a fantastic option for people with diabetes now. Diabetes, as you know, has grown exponentially over the years and is.
Our diets are.
Yeah, unfortunately, it leans towards it for sure. However, what we're discovering, and we just had another case of this the other day, where we were working with a gal, and it was more for her knees, but she did have diabetes as well, has had diabetes for 20 years, and on insulin. So we went ahead and did her knees, and we talked about the possibility that we're seeing that across the board with diabetes, is that the stem cells, again, as they're introduced back into the body, as they excrete these exosomes, it seems to be making the cells of the body more insulin sensitive. Because that's why we get type 2 diabetes in the first place. That's where it comes from, is our cells simply become insensitive to insulin.
How exciting is that, to have a discovery that's something that you thought stem cells would never be able to help, and then find out that they can...
Well, for a lot of people, that's a life changer.
How many people have diabetes in this country? It's
right.
the millions
and how
and
many
millions.
people die from diabetes every year, complications of diabetes. Yeah.
So if in fact stem cells can help diabetes, then down the road there's a possibility of kidney issues.
Right. Yeah. Kidney failure, people on dialysis. This should be something that's absolutely done, at least to try and see what it'll do for them.
So it could be a process that doctors go through kind of on a checklist.
Right.
And
as we go through people's medical histories, because we always take a very detailed medical history if they're coming in, even if it is just for a knee, and see what other kinds of conditions they might be having, and then monitor it and see what they do. So that's why we're studying all these different conditions, is because we want to know, is stem cells effective for things? And we've found things that it's extremely effective for, and we've found some things that it's really not effective for.
And it's interesting that you talk about some of these companies that sell stem cells from youthful tissue.
Mm-hmm.
They probably are out there trying to push stem cells for everything, whereas in your case, your feeling is that there's so many things that stem cells are great at, we don't need to ever use stem cells for something that doesn't work.
Right. Because this is such a burgeoning field that there's a market there. Okay, well, where you've got a market, you're gonna find companies that want to fill that void with their product, and so that's what we're seeing today across the country are what the FDA would call bad actors. Okay, these are groups who are proclaiming to provide stem cell therapy. Patients are paying $6,000 to $7,000 for a shot, only to find out that there were never any stem cells in that concoction. Now, I don't want to say that they're completely horrible, right? These products that are coming off the shelf that they're calling stem cell therapy in a product, where they just order it from a biotech company, they get it in a little 1 or 2 or 5 cc vial. It does have growth factors. It does have some cytokines and other things that can help stimulate growth and improvement. But to say that it's a stem cell treatment and that you're going to get the benefits of stem cells and the exosomes and the things that they produce and how they create that environment to heal and repair, that's just not founded. It's inaccurate.
So some people in the past, and I have a very good friend who's got MS, and he went overseas to get treatment.
Sure. Mm-hmm.
What was the protocol there? What type of treatments do you imagine he was getting?
Again, because it's so new, probably the ones that were on the map first were out of the country. So that's why you see a lot of our football athletes and basketball athletes,
going to
Europe,
of them
still going to Europe, because they've created these alliances and they've got a rapport and they have this reputation. So it's just, for their medical staff, it just makes sense to keep working with these groups because they've had good outcomes, so why not? Well, why not is because now we do it here at home. You don't have to go outside the country. We can do it.
You don't have
here.
to have frequent flyer mileage.
Correct.
To get that
You just
shot.
don't have to do that. And so they're discovering that, and more we've got people coming from all over the world, really.
What are the age restrictions? What age should someone be old enough to qualify, and is there a limit as to?
Yeah, and that's a great question too, because we hear that a lot. Oftentimes we'll get folks in their 70s, even their 80s, concerned that their cells are too old, that they're just not going to produce. And that's unfounded. Actually, we are finding them, again, if you take it from the fat tissue, the stem cells in the fat tissue seem to still retain a very youthful ability to regenerate and to repair, even in somebody in their 80s. Now, beyond that, with every successive year, obviously your cells are going to become a little more depleted, not quite as useful, not quite as able to regenerate or repair. But we helped a gentleman in his early 90s, and he did fantastic. Now, that's not always going to be the case. We know that, and we have to disclose that as we go into that type of conversation, that there's a good chance it may not work, just based on age.
So let's talk a little bit about cost. And you mentioned earlier that you had to go through a lot of training. There's a lot of equipment involved to be able to do this on a timely basis, totally safe. What is a what would it cost for me, for instance, to have my right knee, which is not bone on bone, get back to the point where it's not painful, or at
Okay.
least much more,
Right.
can do a lot more things?
And there's a lot of decisions to be made there because number one, we have to look at the age of the patient. So, and what kind of conditions are we talking about? So there's some variance there. But if all you did was have a bad knee that needed a little help, needed some regeneration, some repair, nothing else going on, you're fairly young, it would be a one-time procedure and it would be $9,800.
Okay.
That's the price.
So compare and contrast that to a knee replacement, which would be $50,000 to $80,000.
Correct.
If I'm not mistaken, can you do any stem cells for math? Because I'm going to try some math right on TV here.
All right.
I think 9,800 is less than 80,000.
Last time I checked.
Okay, just
Yeah.
I'm on top of that. So it's there's no difference, and you miss out on the fun of being in the hospital and going to physical therapy every day for 8 weeks.
Right.
So from a time and monetary standpoint, there's no comparison.
It really makes all the sense in the world.
Now, insurance companies have not gotten behind stem cells. Why is
Right.
that, do you think?
Well, we're knocking on their door and talking to them about what we're doing. And they've got a keen eye on it and they're looking at it. But there are we know that there are alliances between groups. What goes on behind closed doors, we're not invited to that conversation. So there are some hoops and things that we have to go through in order to, one, we need the FDA to work with us here. They've got to be on our side to help us out, because we need the FDA's approval before insurance is ever going to jump on and say, you know what, this is fantastic, it's going to save us a ton of money, we can lower healthcare costs across the board.
I mean, if you think about it, it's kind of a no-brainer. Because in my case, and I love my insurance company, and they've really been great for me, but to have 2 knees and 2 shoulders done is $500,000, not $500,000, but at least probably $350,000.
I've met a lot of $1 million folks out there. You know, you have one shoulder, one knee, and a hip, you know, several days in the hospital, and you're right there. So we need Dr. Scott Gottlieb on our side. He is the commissioner right now for the FDA, and we'd sure like to see him support this. I know there's some controversy in stem cell therapy still. They still don't know whether to call this a drug or is this just an all-natural product that they don't need to oversee, or at least make sure that people, obviously there has to be regulation because they have to know that this is a sterile environment that we're using good
And that's the big
techniques.
advantage in calling you at IMC, because this is what you do
Right.
every step along this process.
We have the team, we have the staff. We have 2 anesthesiologists who combined have over 50 years in practice. They know what they're doing. We have a medical staff. We have MAs and nurse practitioners that help us along the way to make sure that this is all done appropriately.
And you've had great outcomes. That's
For
the
sure,
important thing.
absolutely, yes.
So on a personal level, you and your family moved here just recently from Seattle.
That's right.
Because, I asked why, and you pointed up towards the sun.
Yeah.
So this has to be exciting. You're in a great part of the country with a lot of people who are out and active, and
Yes.
so you're helping a lot of people.
Yeah, we knew Salt Lake was going to be a very important demographic. You've got a central location in the United States, easy to get to, good airport, lots of active people. You know, I love Seattle. A piece of my heart will always be there, but you know, 9 months of gray skies gets to you after a while. You know,
And one of the great things, it was just announced yesterday, is that the United States Olympic Committee is going to push Salt Lake to get the 2030 Olympics, Winter Olympics.
Yeah.
And I had an opportunity to be here for the 2002 Olympics, and it's magic. And just think, that's roughly 12 years from now. Stem cells are probably, if the growth continues, going to be the #1 method of treating Winter Olympic athletes when they all come to Salt Lake in 2030. So
I'm betting on it.
what an exciting, you're certainly going to have orthopedic surgeons for the breaks
Sure.
and that
Yep.
sort of thing. But in terms of getting the best out of these athletes, stem cells will be probably part and parcel of how people compete.
Yeah, by then I'm sure we'll have a even better, more rich understanding of how to best utilize those cells.
So literally, it could be every morning before an athlete competes. Do you ever see it getting to the point where they'll have a stem cell injection?
You know, we do have folks who, You know, there's something called chronological aging, and there's something called biological aging. The chronology we can't change. You know, I am what age I am, but biologically
In Hollywood, you would lie about it and be 10 years younger. we can change that.
and those are the folks who are taking advantage of the opportunity to, what if you infused your stem cells in the tens of millions every few months? What would happen? And so that's kind of an untapped world that we're watching very closely, is how can you change biological aging? Is it malleable? Is it something that you can change? Can you sort of turn the clock back a bit? Well, I can't think of a better way than to infuse your own stem cells regularly over time. I could see that being quite an advantage for people.
Wow.
Not that we want to live forever. I still don't think that that's possible. However, what if you could do it comfortably, or to stay as active as you possibly could?
Because the key is staying active. You just hit the nail on the head.
Yeah.
If you do that, all your outcomes are much better.
Right.
But by possibly down the road doing an ongoing stem cell procedure, you could get to the point where you don't have that pain, that inflation, and you could be much more active.
Right. You step in front of a group of 50 senior citizens and you say, who wants to live to 100? Nobody will raise their hand. They don't want to. If as crappy as they feel right now, they think, I don't want another 15, 20, 30 years of this. You know, I don't necessarily see people excited to living to 100. But what if you could do it without your cane or wheelchair or help or family's help? What if you could stay independent? What if you could live your life the way you would like to, right up to the end?
Wow. And it's funny because you look at certain people. Clint Eastwood is 88 years old, still starring and directing is a Herculean task.
Mm-hmm.
So it shows that, and he obviously hit the genetic mother load. But to be active and vital at 88, what a great dream for everyone.
Sure. Mine
So,
too.
Well, perfect. Doc, thanks so much for talking.
Yeah,
IMC, and you've got to be very excited. I'm really looking forward to getting a chance to talk to you again and hearing your story.
Yeah,
and
let's do. Yeah, the future looks bright.
Thanks so much.
Yeah.